8:14 now. The rough weather has moved on, and it is going to be beautiful for the next 4 days. Nice stretch of weather. Spring officially begins on Saturday, but between now and then, highs of 65 today, a little windy. Highs of only 62 tomorrow, after lows of 42 North Shore, 49 South Shore. And then even colder Friday night, Saturday morning. So it's going to be nice. Sunny, highs in the mid to upper 60s, and then we'll be back near 80 by the middle of next week. It is Brain Health Awareness Week. I think we all want a healthy brain. Our brains take in information and help us make sense of the world around us. But aging and lifestyle choices can affect our brain's health, so that's why we count on Dr. B, our friend Dr. Brent Wallis from People's Health, join us now to help us understand how the brain works and I guess the things we can do to have a healthy brain. How you doing, Doc? Good morning.
Hey, Tommy. Good morning. I'm doing great.
My school song was If I Only Had a Brain from The Wizard of Oz, so certainly I'm interested in this. How does growing older affect our brains?
Well, all of us grow older, and as we do, our bodies change. That's pretty obvious, but that actually also includes your brain and how it functions as well. So it's very common for people to have age-related memory changes, for example. They may have some mild problems recalling names of people or phone numbers, remembering appointments and birthdays, and even sometimes difficulty learning something new or even multitasking. But research has really shown that there's a lot of things you can do to train your brain to keep it sharp and kind of slow that aging process.
It's almost like you would work a muscle. You got to work your brain to keep it working, correct?
Yeah, exactly. You do a traditional workout, so you can build muscle strength and balance and improve the blood flow to your heart. You can actually develop a routine that really strengthens and nourishes your brain as well and really gives it a workout. And, you have to kind of understand how the brain works and kind of the tools that we use. One of the biggest ones is your cognitive skills. So that's what we use to, do simple tasks, to learn, to store memories and then recall those memories and share that information. And so, you use all of that stuff to really think and read and remember. And when you learn new experiences, your brain actually creates new pathways that communicate with other areas in the brain, and that really is your memory and your ability to think. So when your brain is really sharp and functions well, you can really focus, pay attention, and actually finish things that you're trying to do more efficiently.
So what are some of the things we can do to keep our brains healthy?
Really, the most important thing you can do is to constantly challenge yourself. When you become complacent and kind of slip into a routine where you're not learning anything new or you're not challenging yourself for long periods of time, your brain really kind of slows down and sometimes even shuts down. And so there's really a couple of things that you can do to exercise your memory or work your memory. One of the things that's really important is to do things repeatedly. Repetition can actually help you learn new things. You can actually do that to create new memories. You can do that by engaging in a lot of activities, even while you're staying at home. So some of the things that I suggest people do, reading is wonderful and something we don't do as often as we used to. But even playing games or doing puzzles can actually be very good because that challenges your brain. Another thing that's really great is take up a new hobby, maybe try to paint, learn a new language, or learn how to play a musical instrument. Those can be very challenging and really help to exercise your brain as well. And then something I do a lot, actually, home repairs. Something's always falling off the house, and trying to figure out how you can fix that really helps you to build those new pathways. And then one of the most important things is socialization. So, I worry a lot about some of our seniors who don't have interaction, especially during, the last year with their families and their friends. And so it's really important to just pick up the phone and call a friend, or someone that you love and talk with them, because that socialization is so important.
Like you, Doc, I do the home repairs. The difference is I can take a bunch of 2x4s and nice pieces of lumber and turn them into firewood in no time.
Sometimes it gets worse when you try to repair it.
Yeah. You mentioned games and puzzles. What kind of games and puzzles? Does the type matter?
No, it really doesn't. I mean, there's a whole bunch of games or puzzles that you can do. It really just matters if they're challenging to you. So, you could do a traditional board game or card games, a jigsaw puzzle. It's also fine to use your computer or your phone. Everybody's on their phone these days, and there's a lot of mobile apps that you can use that can really challenge you. There's actually some online games that are really especially designed to improve brain function. People's Health has even created some virtual community classes where you can learn about, this topic and a whole bunch of other topics. Those are all on our website.
All right, we'll take a quick break. When we come back, we'll talk about physical exercise and how does that help your brain. It is Brain Health Awareness Week, and that's our topic this week as we talk to our friend Dr. B, Dr. Brent Wallis, the Chief Medical Officer at People's Health. 8:19, time for traffic now, WWL. Tommy Tucker, WWL. We love Thursday mornings. It's 8:24. We get to talk to Dr. B and learn something. I love learning stuff. It's Brain Health Awareness Week, and Dr. Brent Wallis, the Chief Medical Officer of People's Health. I guess learning helps keep your brain active and young as well, right? Learning new skills?
Yeah, we're exercising our brains right now.
All right, well, good. I stretched out before. I didn't want to make sure I didn't pull anything because you know how painful that can be, especially in my case. What about physical exercise, though, really? Does that help the brain?
Yeah, absolutely. Physical activity helps pretty much everything, and studies have even shown that physical activity can really delay the onset of dementia and memory problems. It can even decrease symptoms of depression. Anytime you exercise, you're increasing your energy levels, your attention, and your blood circulation. So that's going to send more oxygen to your brain and help it work better. And it doesn't have to be something super vigorous. It could just be something simple like walking. That's low impact, doesn't cause a lot of damage to your joints, but it really can improve your memory function, your thinking, your reasoning. But then it also decreases risk of heart disease and stroke. So kind of a double bonus there.
People eat certain things to keep themselves healthy physically. Can you eat, or are there things to eat that'll keep your brain healthy?
Yes, definitely. Diet plays a big role in medicine in general, and the brain is no exception. Research has really shown there's a lot of what we call brain foods that not only help your thinking, but they also can protect your heart as well. And so it's a lot of the same things we've talked about with heart disease. Omega-3 fatty acids are very good for your brain. Those are found in tuna, steaky fishes and shellfish, a lot of the stuff we eat here. But in addition to that, any sort of B vitamins are very important and help your mentation. Those are found in lean meats and chicken, dairy products, and dark green vegetables. And then antioxidants are very important as well, in particular vitamins E and C. Those are found in vegetable oils, grains, and nuts, as well as some of those green leafy vegetables as well. And then the important thing to keep in mind is that there are also some foods that really can hurt your brain function. And it's the same things that can hurt you physically. It's those saturated fats and fatty meals, a whole lot of dairy products. If you think about it, if you eat a big po' boy with French fries, which we love, you kind of want to take a nap afterwards, and that's your brain kind of shutting down.
What about some other things that can negatively affect your brain, other physical conditions?
Yeah, your health in general actually does affect your brain as well. In particular, obesity has a huge effect on brain health. Studies have shown that it can actually accelerate brain aging by about 10 years if you're overweight. Yeah, it's really a significant impact. And then, something else we have a lot of is stress. Stress causes distraction, doesn't allow you to focus very well, and so that can have a lot of negative effects on you as well. And then, we already mentioned isolation, lack of interaction with others. That can be very detrimentary as well. And then another big one is sleep. If you're not getting enough sleep, it makes it harder to think, and therefore you can't really challenge yourself. And then, we are talking about health topics, so smoking always comes into play. Studies have shown that smoking can actually shrink the size of your brain, so there's a lot of impact if you are smoking, so you should quit.
One very important thing that we got to talk about is dementia, aging brain, and a more serious condition like Alzheimer's, et cetera.
Yeah, a lot of people, if they start having memory problems, they immediately jump to the thought of Alzheimer's, and it is a huge concern. But Alzheimer's is different from normal aging. Normal aging is occasional forgetfulness, like we've been discussing. Alzheimer's is much more severe. They have difficulty with common tasks every day. They can have personality changes or mood changes. And fortunately, Alzheimer's affects maybe about 10% of the population by age 65. The bad part, though, is that can increase up to a third of people by 85. And so if you're really having daily problems, or especially if you have a family history of Alzheimer's, a sibling or a parent who's been diagnosed with Alzheimer's, you should talk to your primary care physician about that. There are some tests that we can do, some memory tests, where we can kind of figure out if there's some treatment we can do, and it's much better to diagnose Alzheimer's early so that we can try to head off a lot of the severe problems as you get older.
Doctor, one thing I've heard is that the difference is if you forget where you left your car keys, that's one thing, but if you forget what car keys are for, that's different.
Yeah, not understanding how to do simple tasks or what things are for, that's really kind of a hallmark of Alzheimer's. So that's something you want to talk to your doctor about for sure.
It's a terrible disease. I lost my father-in-law to it, and it's more than just forgetfulness, believe me, and you know that, Doctor. Thank you, sir. I appreciate your time. I hope you have a great weekend. We'll talk to you again next Thursday.
Thanks, Tommy. You too.
You can always visit peopleshealth.com/radio. You can call 866-687-7335. And you can always follow People's Health on Facebook, Twitter, and Instagram. Health on Facebook, Twitter, and Instagram. Health on